We are discussing about the infections caused by the dog bites. First infection is the Capnocytophaga carnivorosus. It is a normal bacteria that resides in the mouth of dogs and bites. It is transmitted to humans by animal bites. Symptoms can appear between 1 to 14 days after a dog bite. Symptoms that include a blistering around the wound, redness, swelling and pain around the wound, oozing from the wound, fever, vomiting, diarrhea, headaches and joint pain. Without treatment, complications may arise in immunocompromised patients that include kidney failure, heart attack, and gangrene. The following factors can increase a person's risk of infection that may include are excessive alcohol use, not having a spleen, the presence of health conditions that affect the immune system, taking medications that can damage cells, such as chemotherapy. Treatment includes the antibiotics. The infection may lead to sepsis. When untreated antibiotics can sometimes lead to sepsis. Sepsis is a severe reaction to infection. It can be life-threatening. Signs of sepsis include high or low body temperature, confusion, extreme daytime sleepiness, severe pain or discomfort. If a person suspects that they have sepsis, they should seek immediate medical attention. A doctor will treat sepsis with antibiotics and intravenous fluids. For the tetanus, a dog bite can cause tetanus bacteria to enter the body. Symptoms of tetanus include cramping in the jaw, muscles formed usually in the stomach, difficulty swallowing, muscle stiffness. Tetanus is a serious infection. People with any symptoms of tetanus need immediate medical attention. They will require medication such as antibiotics as well as tetanus toxoid and vaccines. And the symptoms of tetanus include fever, high blood pressure, muscle spasms, locked jaw, sweating, and difficulty swallowing. Now the Pasteurella multocida. In humans, Pasteurella is the most common cause of wound infection after dog or cat bites. High leukocyte and neutrophil counts are typically observed, and it can cause very rapid cellulitis. Erythema can be appeared within 2 hours. It can cause complications up to 40%. Complications include local septic arthritis, osteomyelitis, genocytovitis, bacteriemia, rarely pneumonia or pulmonary abscess in immunocompromised patients, disseminated pasteurellosis in patients with liver disease. Treatment include antibiotics like beta-lactam antibiotics, fluoroquinolones, and tetracyclines. This is the picture of a Pasteurella infection of a dog bite victim. Now the rabies in dogs. Rabies is the fast moving virus in the dogs. A rabid dog may have the symptoms of change in attitude and behavior, changes in bark, drop jaw, excessive salivation, extreme excitability, fever, hydrophobia, paralysis, appetite for nutrition substances, seizures, shyness or aggression, unable to swallow, and uncoordinated. There is a 10-day confinement and observation period. Clinical course usually less than 7 days. Animal dies before the end of 10 days. Rabies is a major public health problem. It is fatal once the clinical signs and symptoms appear. One death uh, every 15 minutes worldwide, and 99% human result from dog bites. 4 out of 10 deaths are in children. Rabies is 100% vaccine preventable. Vaccinate humans to save lives, and vaccinate animals like dogs and cats to stop transmission. If there will be no virus, there will be no rabies, so reduce the population of the dogs. Rabies. Rabies is caused by RNA lysovirus type 1. It belongs to Rhabdoviridae family. It is transmitted by inoculation of infectious saliva. Rarely can be transmitted by inhalation from bats in the caves. It causes a severe uniformly fatal encephalitis. Only 5 documented survivors worldwide so far of rabies. Now the pathogenicity of the rabies. Rabies virus enters via the animal bite, then it replicates in muscles at the site of bite, then virus infects nerve in peripheral nervous system and it moves by retrograde transport. Virus replicates in dorsal root ganglion and travels up to the spinal cord to the brain. And then the brain got infected and at last virus travels from brain via nerves to other tissues such as eye, kidney, salivary glands. The clinical progression of the rabies include after the bite, the incubation period is from weeks to months, in which no symptoms appear and is shorter for head and neck bites. Prodromal phase after the incubation period starts, in which there is which lasts for 2 days to 2 weeks, in which there is fever, chills, and there is the neurological symptoms after the prodromal phase, which lasts for 1 or more week, and then the paralytic phase, in which the paralysis occurs. Know the rabies symptom progression. In prodrome phase, there are fever, malaise, headache, sore throat, And in neurological phase, there is paresthesias at bite site, anxiety, restlessness, insomnia, dysphagia, hydrophobia, and that is fear of painful esophagus spasm and seizures. And it then lead to flaccid paralysis and then leads to coma. And then there is cardiovascular collapse. Supportive treatment is generally ineffective to death. Uh, so the disease once occurs and the symptoms and clinical signs appear, it is approximately 100% fatal. Now the rabies disease stages. The incubation period is about 30 to 60 days, and then there is the prodrome phase which lasts for 2 to 10 days, and then in stage 3 there is acute neurological phase which lasts for another 2 to 7 days, and then after the neurological stage is the stage 4, that is coma, and after coma the patient dies. No rabies virus infection. Rabies disease causes hydrophobia, hypersalivation, consciousness deterioration, agitation, irritability, and aggressiveness that ultimately leads to the zombification, that is the lack of cognitive control. There is hyperirritability in patient and furious and violent behavior. Protocol for starting rabies prophylaxis. Prophylaxis is indicated in high risk bite and animal and when animal escapes, and high risk bite and animal captured, send animals head to state of health lab for pathological examination. Treat only if lab confirms rabid animal. Low risk animal and animal escapes, consider prophylaxis only if the bite is clearly unprovoked. Low risk animal and animal captured, keep animal under reliable observation for 1 week. If animal gets sick, immediate check by veterinarian or state of health lab. If animal remains well 7 days, no rabies prophylaxis is indicated. Now the rabies prophylaxis. Post-exposure rabies prophylaxis included if the animal shows signs of rabies or dies within 10 days of observation, if the biting animal cannot be traced or identified. In general, if a biting dog does not die within 10 days, rabies is unlikely. The rabies vaccine includes our human diploid cell vaccine. There is another vaccine, that is neuro tissue derived vaccine, that is no more in use nowadays. The number of doses of human diploid cell vaccines are 5 doses that are given at day 0 when the dog bites, and then at the third, 7th, 14th, and the last dose at 28th day. The quantity is 1 ml. The route is intramuscular in the arms, and then the other treatment option along with the vaccine is the passive immunization with immunoglobulins. And the number of dose is only one, and quantity is 20 international units per kg. Route is half dose intramuscular half, and one half dose is given subcutaneously around the bite site. Pre-exposure prophylaxis indicated in uh, 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 is the human diploid cell vaccine, that is 1 ml, that is given intramuscular on days 0, 7, and 21. There is 3 doses in pre-exposure prophylaxis, and this is utilized for forest rangers, veterans, and others who have higher risk of incotic rabies. It still requires booster dose after each exposure. Pre-exposure prophylaxis also includes these measures like vaccination of domestic dogs, elimination of stray dogs, eliminating rabies in dogs, and active immunization doses that are already discussed. In no rabies in Pakistan. In Pakistan, 2,000 to 5,000 cases of rabies occur per year. Rabies is endemic in Pakistan. Human rabies is a not notifiable disease in Pakistan. The main vector for rabies in Pakistan is the domestic dog. This is the news article that is published on 10th July 2021. The article title is Over 50,000 citizens bitten by stray dogs every year in Karachi alone. The points given in the article are: every year around 50,000 citizens are bitten by stray dogs in Karachi alone, where the estimated number of spy dogs living on the streets is about 2 lakh. Experts said that blamed the poor solid waste management as the root cause of growing number of canines in the city and the rest of the province. At least 129 people have also lost their lives due to rabies encephalitis during the last 10 years at Karachi's 2 hospitals. There is need to vaccinate at least 70% of stray dogs in the city to achieve herd immunity against rabies instead of killing the canines. Their plan is to eliminate rabies from the soil of Pakistan in the next 10 years. Uh, that is 2030, which looks an ambitious target, but it can be achievable. This is another article published in newspaper on August 17, 2021. The title is Punjab State Gets a New Deal. In this, the provincial cabinet has approved a comprehensive policy regarding the population control of street dogs instead of killing them. In a bid to walk their talk, a bill will be tabled soon, and medical equipment and vaccination for sterilization of strays has been provided at veterinary centers set up in different districts of Punjab. The aim is to don't kill the dogs. Anaiza Mulk, that is the representative of one of the NGOs of the animal protections and rights, said that previous methods of killing free roaming dogs like poisoning are not approved by WHO. She identified several disadvantages to poisoning or killing of dogs. It is detrimental to our ecosystem as dog uh, carcasses lie on the ground for many days, polluting both air and soil. Killing stays also means those animals and insects that become food for dogs will increase. She informed that United States, Europe, and neighboring India have all banned the killing of dogs by poisoning and shooting. They introduced a new policy. According to the source familiar with the new policy involves several steps that include the staff of the Metropolitan Corporation will rescue the dogs from their district and register them. Then the dogs will be handed over to the livestock veterinary center, where male dogs will be neutered and female dogs will be operated on to disable their ability to reproduce. After that, they will be vaccinated against rabies. Once these steps have been dealt with, the male and female dogs will be released into their natural environments, as their bites will no longer are risk for rabies. This is the slogan by the WHO in collaboration and Food and Agriculture Organization of the United States. The slogan is to zero by 30. The aim is to eradicate the rabies by the year 2030. World Rabies Day is celebrated on 20th September of every year, in which the awareness is given to the population about the preventive measures of rabies. This is an article uh, from Pakistan whose title is Patterns and Outcomes of Dog Bites Injuries Presenting to Emergency Department in a Tertiary Care Hospital at Karachi. The methodology in this is that this was a one-year descriptive cross-section study from 1st June 2018 to 2019 using consecutive sampling techniques. Data of about 7,500 patients was collected from annual bite clinic for Toshika Hospital. The conclusions of the study is that research reveals males belonging to adult age group were most vulnerable. Most bites were inflicted in early or most common animal inflicting bites were stray dogs. Many victims did not complete their vaccination from the same center. Peak of summer was associated with the decline in number of incidents. Now the session for MCQs. First MCQ is a 50-year-old alcoholic patient present to emergency department with a dirty wound on his leg with blisters around it. Along with redness, swelling, and pain and fluid oozing from the wound, he also has fever and headache. He gave history of a rabies immunized pet dog bite 3 days ago while playing with him. From which disease he is suffering from, whether it is rabies, tetanus, capnocytophagia, or pasturella. Which is the correct option?
Rabies.
No, it is not rabies. These are not the symptoms of rabies. These symptoms belong to the capnocytophagia infection. Second MCQ is a 29-year-old farmer brought to emergency with complaints of fever, high blood pressure, sweating, lockjaw, and difficulty in swallowing. History reveals that a roaming dog attacks on him 3 weeks ago while he was working in fields and he got some minor abrasions, which he left unnoticed and did not take any medical measure for his wound. Later, his condition starts deteriorating after 1 week. From which disease he is suffering from, whether it is rabies, tetanus, capnocytophagia, or pasturella.
Tetanus.
Rabies.
No, it is not the rabies. It is tetanus, as there
Tetanus.
is the
Yes.
lockjaw and difficulty in swallowing. Third MCQ is a 9-year-old boy from a village brought to a hospital with complaints of pain and swelling in joints and a red erythematous patch on his left leg. His parents told that he got a minor wound on his left leg by a bite of their puppy dog few days ago. They applied turmeric powder and chilies on and off on his wound from which disease he is suffering from, whether it tetanus, capnocytophagia, pasturella, sepsis.
Sepsis.
Uh,
Sepsis.
no, he is suffering from pasturella. Fourth MCQ is a 19-year-old frightened college boy came to DHQ Hospital Sahiwal after a minor bite of farmer's dog in a playground of a college. Upon inquiry, he told that the dog bites him when he went near a dog to pick up his ball. Dog's owner told him that the dog is not vaccinated. However, the dog is otherwise healthy. He is worried about getting the rabies and wants to get vaccinated for rabies. How will you counsel this boy regarding vaccination? Whether all dog bite victims should get rabies vaccine, advise him to observe the dog for any illness in dog for 1 week, or there is no need of vaccination in minor bites, or there is no use of vaccination after exposure. Which is the correct option?
A. A.
No, B is the correct option. All dog bite victims do not require rabies. A 40-year-old man came to emergency at 2 a.m. on night after a bite of a street dog while he was going to a home from the railway station. He got 2 into 3 centimeter wound on his right arm. What immediate step is needed regarding his wound management? Whether to apply sutures and advise him to change the dressing daily, wash the wound with normal saline and apply sutures, or wash the wound with normal saline and let it open for secondary closure, or apply bandage and prescribe broad spectrum antibiotics.
C. C.
Yes,
B.
C is the right option. Wash the wound with normal saline and let it open for the secondary closure of the wound. A man from USA got abrasions on his hand while playing with his dog pet. How his family members can give him first aid, whether by washing the wound thoroughly with soap and water, or by a two-way course of augmentin antibiotic, apply or by applying antibiotic cream and then bandage, or there is nothing to worry about.
A.
Yes, A is the correct
A.
option. First aid that can be given is to wash the wound thoroughly with soap and water immediately. Seventh MCQ is a villager from southern Punjab brought to Tertiary Care Hospital in Lahore with restlessness, irritability, agitation, fear of annoying voices, bright light, water, and food. His pet dog bites him 7 weeks ago, which later dies after a few days. Choose the correct option. Start a course of rabies vaccine and immunoglobulins. Treat him for some other disease as he is not suffering from rabies, as there is a long time past when a dog bites him. There can be better health outcomes if he is properly treated, or the patient's life cannot be saved. Which is the correct option? As the patient has developed the rabies signs and symptoms, so up to date, there is
A.
D is the correct option as the patient has developed the rabies signs and symptoms. So after the development of signs and symptoms, there are no health outcomes. The disease is 100% fatal. So D is the correct option. Eighth MCQ is a man is bitten by his pet dog in Lahore. He noticed a strange behavior in his dog from few days that he is not eating well. There is extreme aggression in dog, unusual bark, excessive salivation, and fear of water. Choose the best option regarding the medical management of this victim. First option is patient life cannot be saved with any measure. Our patient life can be saved if proper and timely vaccine and immunoglobulin course are administered. Patient's life can be saved if vaccine and immunoglobulins are administered after the onset of rabies symptoms, or no use of vaccine and immunoglobulins once a rabid dog bites human. Which is the correct option? B is the correct option as the patient has not developed till the signs and symptoms of rabies, so he can be saved if proper and timely vaccination and immunoglobulins are administered. That is the post-exposure prophylaxis for rabies. Choose the correct option regarding the role of antibiotics after a dog bite. Which is the correct option you have to choose? First option is indicated in all cases of dog bites as dog has numerous bacteria in the saliva. No role of prophylactic antibiotic whatever the wound is has a role if suture has to be applied on a large wound and that is penetrating periosteum. or it is only indicated after the signs of infection appear in the wound? Which is the correct option? C is the correct option. Uh, Antibiotics are not given routinely prophylactic for all dog bites. It is only given if the dog bite wound is too large, or it is penetrating the deep structures, or when it is a dirty wound, or when it penetrates periosteum or the other bones or structures. Last MCQ is, as there are many cases of rabies-related deaths are reported in Pakistan, what measures should the authorities have to take to stop it? Choose the best option. Whether pre-exposure prophylaxis of rabies of 70% human population, killing of stray dogs by shooting and poisoning, sterilization and rabies immunization of dogs, ban on petting the dogs and cats. Which is the correct option? C. Sterilization and rabies immunization dogs is the correct option. The rabies can be controlled by the sterilization so that the population of dogs can be controlled, and then the immunization of dogs so that they can spread the rabies. This is the key of my MCQs. This is the references of the presentation, and thank you very much.
Okay, thank you very much, Dr. Awais. Very nice presentation. I want to elaborate one thing, if you please like to clear it, that you have said that the wound after the bite of the rabid animal, it may be a dog, cat, or any mammal, it should be washed with soap and water. What is the logic behind this?
Ma'am, yeah. The first aid management of animal bite is to wash the wound with soap and water to wash out all the germs and dirt from the wound, so that the infection cannot occur in the wound. This is the logic, to wash away all the germs from the wound. This is the point, and that is to wash the wound with soap and water so that it flush out all the germs from the wound.
Are you hearing me?
Yes, I am listening now.
Right. So the second part of the wound management is, the first part is always washing it with soap and water, and the reason is the alkaline medium of the soap helps the virus not to penetrate deeper into the tissue, and so that it cannot enter into the nerves. The second important part is that we also have to infiltrate the anti-rabies serum into the wound so that it would decrease the infiltration of the virus and neutralizes the antigen that is present there, and would not allow the virus to enter into the deeper tissue, and so that it cannot enter into the nerve endings. So these are the important steps at the wound management. Later on, yes, it has, the bleeding has to be stopped as soon as possible, and the other important first aid mechanisms, like if there is any bleeding or bleeder that is identifiable, that bleeder should be stopped from bleeding by giving the stitches, etc. So the next part is that once the person has been bitten by the animal, he or she should be given the vaccine as soon as possible. So these are my 2 cents in this discussion. If anybody has any question, please do let me know. And Dr. West, you want to say something? Please go on.
No, ma'am, I have finished my presentation.
Okay, thank you very much. If there is no other question, Allah Hafiz. See you tomorrow, inshallah.
Allah Hafiz, ma'am.